The job of instilling ethical behavior in court professionals is more important now than ever before. Conducting oneself ethically inspires public trust and confidence. In addition, it promotes the court's commitment to impartiality, equity, fairness, and integrity. The question is, how do we convey the importance of ethics in the age of the coronavirus with almost no ability to gather together in person? I'm Pete Kiefer, and I'm here with my co-host, Carl Tanis. Now, usually, along with Judge Sabers, we present highly interactive, in-person performances using audience members to depict ethical situations. We then facilitate lively conversations on the ethics of those situations. Well, today we're going to recreate that interactive experience using NACM's Ethics Core Curriculum in a virtual environment. We're presenting two scenarios, and after each performance, we've invited some court professionals to discuss the ethical implications. With the discussions of these scenarios, we achieve several core learning objectives. You'll be able to start assessing the effectiveness of your court's ethics code. You can apply the NACM Model Code of Conduct to topical ethical situations. And you'll be able to evaluate the knowledge and commitment your court has to its ethics code. I'm now going to turn it over to Carl for his thoughts on today's presentation.
Thank you, Peter. At first, the two scenarios coming up may seem very dissimilar. One about personnel management in the time of pandemic, and another about program administration of one of the court's programs. But in fact, in some ways, they're very similar. They're very much about striking a balance between our obligations of openness and impartiality and even-handed treatment and transparency to the public against the pressures of the moment, of practical pressures that arise, and the demand that we administer both our employees and our programs as fairly and equitably and openly as possible, regardless of whatever pressures we may operate under at the moment. I think even in this new format, this discussion delivers on those objectives and raises a lot of the interesting issues in this topic.
Now, we want to hear from you, so use that chat message option. We use your comments and suggestions to improve the scenarios and make them even more timely. Both Carl and I are available to respond to your chat messages. Now, this virtual format may not be for everyone, but if you're open-minded like us, you will immediately be able to see its potential. Our first video involves the ethics of making decisions under time pressure. It's called, Can You Be Candid During a Crisis? So, on with the first scenario.
The coronavirus pandemic has forced challenges on our courts unlike anything we've ever seen in our career. It's also posed unprecedented ethical questions.
Are there times when a court professional must choose between being fair and open and making tough decisions under tight timelines?
In this scenario, presiding Judge Alice Fair and Court Administrator Max Crutcher are managing the Metropolitan Circuit Court during an epidemic. The governor has ordered businesses and government offices closed for at least 2 weeks. The Chief Justice has authorized paid emergency epidemic leave for those court employees who do not have enough sick leave to cover the time they will be out. So let's join Judge Fair and Max as they struggle to be fair and open and yet expedient.
Your Honor, you just spoke with the State Administrative Office. What did they have to say?
To cope with the epidemic, the State Administrative Office told us that we need to tell them the grand total number of emergency leave days our court will need by the day after tomorrow. We need to move fast.
Max Crutcher, do you know how many employees will need paid epidemic emergency leave?
HR told me that there are 40 employees without enough personal or sick leave days to cover the whole 2 weeks. Of those, there are 10 who have been counseled for being sick leave abusers.
Out of fairness, I want the emergency leave to be given only to those employees who do not have enough personal and sick leave to cover the 2 weeks and who have not previously abused their sick leave. Employees who are sick leave abusers just need to be furloughed.
Since the state office needs our report so soon, we don't have enough time to announce our policy to the entire staff and engage in a long drawn-out discussion about it. I am just sending emails to individual employees telling them of the number of emergency leave days that they will be receiving.
To complicate matters, State Auditor Norman Trimble is reviewing the allocation of the emergency leave.
Mr. Trimble, what's your view on allocating this leave?
Believe me, I am sympathetic to the plight of employees during this crisis, but we must be good stewards of the taxpayers' money. Part of that stewardship is that we don't give out emergency leave pay to government employees to do nothing. That is called welfare. Paying government employees to do nothing is unethical. And if I find an agency that is doing that, I will let both the legislature and the media know, even if it means scandal.
So let's see how this rapid allocation of the emergency leave is being received by some of the employees. Here's Mildred, Derek, and Reva, who all work for the court.
I'm Mildred. I've been labeled a sick leave abuser. I've used up all my sick time, and I have not been awarded any emergency leave either. The problem is I get debilitating migraine headaches. I've discussed this with my supervisor. Every time I get these headaches, I stay home because I can't function. My supervisor says you need to go to the doctor and get a note every single time. If I'm laid out and debilitated, I can't run to the doctor. Now, I don't know how I'm going to pay my rent. I don't know how the court came up with this decision. We certainly weren't included in any decision making. I don't know where they got this whole idea. I'm disgusted by it, and I feel it's completely unfair.
Hi, I'm Reva, and I guess I'm also a sick leave abuser too. I often take Mondays off as sick days because I get terrible headaches. Maybe it's because I partied a little too much this past weekend, but frankly, that is none of the court's business. I should be allowed to use my sick leave whenever I believe I am sick.
I'm Derek. I actually have enough leave to cover the next 2 weeks, but why should I have to use my sick leave when others are getting a free ride? The court should actually give everyone 2 weeks emergency leave, whether or not they have sick leave available to them. It's simply not fair that we have to use our sick leave.
Max, sounds like some employees wanted more explanation and more time to discuss matters.
First, I've worked with the state office long enough to know that if we got into a long drawn-out debate on how to allocate the emergency leave, we would miss the deadline and then no one would get anything. And secondly, obviously, if Mr. Trimble, the state auditor, discovered we were giving out a straight 2 weeks of emergency leave to all employees, it would be a huge scandal. That's the last thing that Judge Farrer needs since she is running for re-election this year.
Now, I've heard a rumor that supervisors and managers are going to be allowed to telework, but they can't seem to figure out a way to get line staff to telework also. Managers won't be getting emergency leave, but also won't have to use their sick leave. All the while, line staff will have to use their sick leave. How is that fair?
Before we join my two co-hosts, let's review a couple of the relevant canons from the NACA Model Code of Conduct.
Canon 1.1 calls for court professionals to strive at all times to perform their work honestly and openly. The canon upholds the institution of courts as independent and fair. Canon 2.2 calls on court professionals to conduct their work without bias or prejudice. The canon adds detail to Canon 1.3 on fairness, which calls on court professionals to conduct their business in an unbiased manner.
So let's join my two co-hosts and our panel as they discuss the ethical implications of this scenario.
With me are my two co-hosts, the Honorable Susan Sabers, Judge in the 2nd Judicial Circuit Court, and Carl E. Tonnes, Court Administrator for the 2nd Judicial Circuit Court, both from Sioux Falls, South Dakota. Our panelists include Danielle T. Rossetti,
Clerk of the Superior Court in Guam, Sarah Brown Clark, elected Clerk of the Municipal Court in Youngstown, Ohio, and Elizabeth Rambo, Trial Court Administrator for the trial courts in Eugene, Oregon. Welcome to all of you. I'm now going to turn it over to Carl, who will offer some overarching questions that viewers might want to keep in mind while watching this scenario.
Normally during these sessions, we conduct an electronic poll of the participants in the room. In this format, of course, that's not possible, but it may be worthwhile or helpful for the panel and viewers later to frame this topic in this scenario with the following question in mind. Did Judge Farrer and Max act as openly and honestly as possible? Yes, they did the best they could under the circumstances, or no, they should have found some way to communicate more openly with staff on this decision. But for now, let me pass it to Judge Sabers to begin the discussion. Judge?
Okay, Sarah, let's start with you. Have you had situations in which you've had to make a decision without being able to consult much with your staff about those decisions?
Yes, absolutely. And just recently, what actually happened in my court, and I think the organization of the court is a factor too. Most of us do respond directly to the judicial order, and we had a similar situation where the governor asked that we close public facilities, and the Supreme Court justice agreed, and so our court was closed for a time period, and then we worked on a day, off a day, on a day, off a day. And so I think that when you have to make those decisions, you can't necessarily consult with staff because it is a judicial decision. But secondly, I think we have to consider whether or not we are working with at-will employees or we're working with people who are unionized, because at-will employees are serving at will, and they really, I mean, it's nice if you can ask people, but it's not required. So I don't think in that situation it's a problem. I think the judgment comes down and you move forward and you just inform them of what the judicial recommendation is.
Sarah, in that situation, how did you communicate to staff what the plan was moving forward?
Actually, I had a brief staff meeting, and I informed them that the judge was closing the court down and that we would all be. Now, in Ohio, in our situation, everyone, well, it was a unique situation because they were furloughed, and then they were subsidized by the federal government because they went on unemployment. We did not discuss using sick leave or vacation time. The way that the ruling came down and the option that we had was that they would just be furloughed and they would continue to be paid. And then as the situation worsened, I did furlough some employees. I called some back when the court opened up, and I furloughed others. And let me say that the ones that I furloughed were the ones with the highest absentee rate. Now, they might have said they were sick or whatever, but we all know how disruptive it is when people are out of the court and business is going on as usual. So I furloughed the ones who take sick leave most often, and I did tell them that.
Okay, and Danielle, have you had similar experiences, and how did your court respond?
So similar to what Sarah described, one, you look at the structure and of the organization. We are a unified courts, and we our head of our branch is our Chief Justice, and so in consultation with our administrator of the courts, and really falling in lines with what the governor set out. And here we had a stay-at-home order, close the courts, close the government offices and the businesses the first 2 weeks. It was the same situation across the country. What we had to do was, the Chief Justice and the Supreme Court issued an administrative order, and to date, that's what's our guiding document. It is difficult to contact staff to advise them of what is going on and to get their feedback and their input. But in the short amount of time that we had to, address the pandemic issues, the The administrative order and, of course, the management team were key to contacting and communicating with staff. We have been fortunate. We don't have unions in our organization, but we do have what we call classified and at-will or unclassified employees, but a good amount of our employees are protected classified employees. So we have not had to date, had to furlough any staff, but we have had to make some, decisions on teleworking assignments and essential staff. But our Chief Justice and our Supreme Court guides the direction and the operations of the court, but it all falls in line with what our governor sets out for the island in order to handle the pandemic. So,
and Elizabeth, can you tell me a little bit about your scenario?
In terms of the decisions that we had to make around closure and around awarding leave for employees or not during closure, we were not unlike the scenario, given some resources and asked to quickly apply them. I think we did a pretty good job of being transparent with employees. Even though we were on very tight timelines, I scheduled all staff telephone meetings and really tried to get the information out to employees about what was happening and what kind of leaves that they had available to them based on their own situation, whether they had a serious health condition so they couldn't be at work, or children that they had to take care of because schools were closed. Oregon's courts never closed completely, so it was a little bit of a different situation. But we tried to be open and transparent with staff and just get the information out there so that they understood the driving pressures behind the decisions that we were making.
And Liz, did you feel like that communication actually improved this such situation and kind of appeased some of the fears among staff?
I don't know that it appeased fears or satisfied them with regards to the outcomes of our decision, but what it did do is provide them with the information they needed to understand the decision-making process. And I think that even in the very shortest of timelines, that kind of information is really a lifesaver for people to understand.
One of the things, Derek, in the scenario, every time he started to speak, he would say things like, well, I've heard this and I've heard this, and you could almost hear the anger in his voice that no one had really formally told him what the plan was. It was just that he was hearing it through kind of the sidelines. And Liz, you used the word transparent, and Sarah talked about having a meeting with her staff. And I think at a time like this, we can remind ourselves that communication is hugely important, and getting bad news is one thing, but hearing bad news through the rumor mill and not having anyone officially share it with you makes it, I think, even worse news. So thank you all. Liz, tell me, what do you think Judge Farrer and Max should have done when they were faced with the Mildred, Derek, and Reva situations? Any suggestions for how they could have softened that blow?
Well, I think I already tipped my hand a little bit. They decided to treat people with enough leave and without enough leave in two different categories. And that was really driven, it seemed to me, like from the pressure from the state auditor to not award too much free leave. So in the situation of Derek's concern, if they had had some sort of formal communication as quickly as they could, whether it was email or a quick telephone all-staff meeting or something, to explain the driving forces that required them to make people with enough leave use the leave, that every person in their court who had enough leave was going to have the same question that Derek did. And so they could have answered that question before it even came to them. You should expect it. So that's one thing. The other thing is they decided to treat people without enough leave in two different ways. And I think that's really where they kind of put themselves in a bit of an ethical bind. So those are people in the same category of not having enough leave for two different reasons in their minds. One reason is that they were counseled and they should have known better. And the other reason is that they weren't counseled and so therefore they were blameless for being out of leave. Those two things are probably not necessarily true. And so we can sit around all day and talk about whether it's a good idea to pile on additional disciplinary consequences for people in the middle of a pandemic, but that's not the question you're asking me. the question you're asking me is, should they have accommodated someone? And in that instance, the answer is yes, absolutely. Mildred's leave and her classification as a sick leave abuser was inappropriate. Chances are good that her leave would have been protected leave under Federal Family Medical Leave Act, if not under a state one as well. And so that supervisor's decision should have been reviewed, and in fact would have been reviewed before any additional disciplinary consequences would have been levied on her. So at the very least, they should have taken the time to look at those 10 people and see whether or not they agreed, if they were absolutely dedicated to not giving any additional leave to abusers, and looked at those 10 people and made absolutely sure that they were correctly classified as abusers of leave.
Okay, Carl, back to you.
Thank you, Judge. Liz, this scenario is similar to events that many of us have experienced, especially early on in the crisis. And so the auditor's concern in the scenario about paying public employees for not working it comes up from time to time. And so in your mind, is it fair that some court staff got paid for their leave while many private sector employees and employers were not able to pay their people? How would, as a matter of ethics and fair treatment and as a matter of public policy, how would you justify that distinction that occurred in so many jurisdictions, and how would you justify that to the taxpayers?
You know, this is a conversation I've had with my employees over and over again. There's absolutely nothing about this pandemic that we could classify as fair. I talk to them regularly about, do not look across the aisle and compare your situation to the person next to you, because I'm going to tell you there are compelling reasons why they're different and they're not equal and there's nothing fair about it. So that's not really a public policy conversation, though. So the public policy conversation, I would say, is the fact that courts need to have continuity of services to provide those essential public services for fair and accessible justice very quickly, even during a pandemic. Too much employee disruption is going to create a situation where you're not able to provide continuation of services. So providing some limited ability to maintain employees going forward is, I think, probably the real compelling reason why you would want to provide some limited leave or access to some sort of offset so that employees can continue.
Thank you. Sarah, do you have a perspective on that same question about equity and fairness?
Well, I did give that considerable thought because in many of the public agencies, people are working limited time and still receiving full payment. And I do not know what the outcry will be if and when people realize that's the case. A lot are working at home and they're available at home, but they're still receiving payment for 5 days a week as opposed to only working 2 and sometimes 3. But in that situation with Mildred, Derek, and Reva, I think there are 3 very different scenarios. I understand Derek because he feels as though he's been a conscientious employee and he has not abused any of the privileges that come with his position. And he really doesn't like the fact that there are those who are at least perceived to have been abusive of the liberties that they have. So he really is raising a legitimate point. Now, our party girl, she's made it very clear to you that she stays home on Mondays because she parties too hardy over the week. So that's clearly an abuse of sick time, and she made the statement that it's none of our business. I have no sympathy there. And then for Mildred, we all work with the public and we know that people play games. Actually, I taught at the university for 30 years, so there's no story that any staff member can bring me that outdoes what my students used to bring. Mildred, if she has a chronic condition, then that should be documented and on file. But even if that is the case, sick leave is sick leave. Now, My problem with this scenario is that they were required to use sick leave and vacation, because I believe if the public entity closes down, that's a penalty to say that you need to use your sick leave and vacation. The office is closed. You can't go in. So I don't think that that was a good option to say sick leave and vacation. But as they did say that, I sympathize most with Derek. I don't have I have no sympathy for Reva. And Mildred should have documented this a long time ago. So there are three very different situations, and they really don't even prepare us for the question that you were asking, Carl, and that is, what would the public say if they knew that public employees are staying home 2 days a week, perhaps 3 days a week, and still receiving a full salary? And let's be honest, all of them are not working from home. And I realize the pandemic creates a whole new scenario, but I have a little bit of personal guilt when I hear about people who are experiencing serious financial difficulties because they are unable to go to work and they're not receiving pay, and my staff is still receiving pay. And in Ohio, and in some other states, maybe it was national, if you agreed to furlough people, then they oftentimes brought home more than they made when they were working. Now, those people who were furloughed were on unemployment, and that's a different situation. So when we look at that, we've got a host of different situations for this circumstance. Because if you're laid off or you're furloughed and you're able to go and get unemployment in addition to a subsidy, that's a lot different from being furloughed with no pay.
Thank you. You know, Liz, along those same lines of equity between employee groups, do you have any thoughts on justifying the distinction when it comes to work at home for upper level management employees or supervisory employees, and then the frontline staff who many times weren't able, for practical or other reasons, to work from home? In other words, the frontline staff often got hit with the need to burn leave, while management and supervisors had a lot more flexibility. Any thoughts on that topic?
Yeah. In this scenario, in particular, Derek said he'd heard a rumor that manager was getting to telework. And so once again, if they'd have confronted that head on and described to their employees that managers were going to be required to work while the court was closed, and part of what they should have been working on was figuring out a fair and equitable telework distribution for the rest of the operation for when they were ongoing. I think that where courts end up in a ethical situation is where they assign telework or what seems to be a privilege of telework to people who are considered to already be in a privileged status, like management. And so we've been very careful to make sure that we assign telework based on the job classification ability to telework. So here in Oregon, we're very lucky to have fully integrated, document management system and e-filing and everything. So we have a lot of employees in data entry type jobs who are able to work telework and accomplish a lot of work out of the queues in the home environment. Management, not so much. We don't telework because we need to be here to support the on-site staff, the people that are helping the customers still at the front counters and opening courtrooms when people come and those types of things. So we really tried to assign telework based on the requirements of the job duties and not on some sort of other classification, because I don't want to be in a situation where we're called out for preferential treatment of managers.
Thank you. Danielle, if I could invite you to respond too on this topic, not only in the distinctions some jurisdictions drew between upper level employees and frontline staff, but also groups like kids and no kids, because of course if you had to deal with a school closure, those employees needed to be home. those without kids often still stayed at the courthouse, and so some equity and fairness issues arose in those scenarios too. Any thoughts in that topic?
So I think, Liz hit it right on point when she said being open and transparent at the forefront, at the get-go, being open and transparent with all staff. And again, it's making them understand as managers, you are required to report and to do the work. And for the line staff and all the other staff of the organization, it's looking at their duties. There is, like she says, nothing fair about this whole pandemic. We got to take a look at performing the essential functions of the judiciary and of the court, and how can we best do that? Coming up with novel ways of teleworking assignments. Teleworking could be professional development. Utilizing the NACM resources, having the staff that can't perform those functions in the building because the courthouse was closed, to be creative and to try and find ways to improve their skill set while they're at home, recognizing that we are still trying to balance. I think the overarching situation for all courts across the country was that we were trying to balance the public health and safety concerns of, not only our staff, but our families at home. And we had struggles where staff could not come in because of childcare, but we found a way to have fair and equitable assignments of teleworking. And for reporting into work, we had a telework policy. So there was a constant dialogue between management and line staff. And, all of that was driven by, again, our Chief Justice, our Administrator of the Courts, and being in daily contact with our staff members. I think that's very important, keeping that dialogue. As the scenarios mentioned, Derek was very frustrated. How is it that he's got to use his paid leave, and, managers are allowed to telework, but he didn't understand, why is it that we have to report in as managers? There are more important things that we are operating under behind the scenes, but just getting staff to kind of understand the situation that the court is in and the short time frame that this was going to occur here. We were looking at a 2-week period in the scenario. I think when you take a look at the totality of the circumstances and taking a look at what's being open and fair and honest in performing your jobs as a court professional, I think those are key points that as professionals in looking at the canons that we are guided by, and that we need to be transparent. And the only way to be transparent is to be forthright with your staff, because they will be there to support you when you need them.
Well, I think, though, that there are a lot of different scenarios that we're examining here, because when the court closes down completely, and that happened in a number of courts in Ohio, the buildings were locked down. That's a little different from a situation where you're operating at 50% or whatever. When the buildings closed down completely, that means that you couldn't come to work even if you chose to. So why would you be penalized and required to use your sick time or your vacation time? And many, I won't say many, I don't have a number, but a significant number of courts locked the buildings and closed down. And I wanted to say something else. People might be annoyed about how this happened, because it happened in many of our situations overnight. But they would be even more annoyed if they had been required to come to work while the pandemic was surging and they felt that they were in harm's way. Particularly, I'm a clerk and we have counter staff. We're dealing up close and personal with people. I do not think they would have been happy had I said, you need to be here anyway. And the court can't operate without us, and there's nothing for us to do without the court.
So, Judge Sabers, what are your takeaways from this discussion?
I keep coming back to the ongoing theme of communication with your staff. And we heard phrases like continuing dialogue when Danielle was speaking. We heard the word transparent when Liz was speaking, and we heard about Sarah's meetings with her staff. So much bad news has been given to our employees during this time of pandemic. And I don't simply mean within the walls of our courthouses. They've got bad news at home. Their kids get bad news at school. There's plenty of bad news to go around. But if you can communicate with those folks, I come back to the Derek situation, and I think, again, the anger that he showed about hearing those rumors. If someone had sat down in a meeting with Derek, I'm not saying he would have been delighted with the result, but if someone had said, hey, here's how we're handling this, we think under such short notice, on such a short time frame, we're going to handle it like this. We understand you have individual concerns from your own situations. Let's talk about those. Had someone really invited that discourse and really given the explanation up front, I think we can fix a lot of our problems and heal a lot of wounds before they get deeper and really turn into those kinds of complaints. So if I have one takeaway from this situation, I think it's the importance of communication and how we sometimes overlook that. We're worried about the merits of the bad news we're giving or delivering, and we forget that communication can help with that.
Carl, what are the points that impressed you the most?
Thanks, Peter. I have to say two things came to mind. First, we frequently say that these ethics sessions, whether they're live or virtual, are designed to help us better prepare for practical reality when these situations arise. This entire discussion and the pandemic in general has made me realize that no matter how hard we prepare or try to prepare, some things just overwhelm us with the level of challenge. The second thing is, Elizabeth mentioned, and if we were in an actual physical presentation room, I think I'd give her a high five if it wouldn't increase exposure with her point about nothing about a pandemic is fair. I think that's exactly true. I mentioned the kids and no kids circumstance. I mean, to me, that's one of the most compelling of all. We have ideals, we have ethical standards about even-handed treatment with our employees, about open communication, assuming we have enough time. We have all those ethical standards, but sometimes we have to balance them against practical realities and individual circumstance. So I certainly appreciate all the panelists' contributions. I certainly found this very worthwhile.
My thanks to my two co-hosts, Carl and Judge Sabers, and to our panelists, Danielle, Sarah, and Liz today for sharing their thoughts on this ethics scenario. I'm Pete Kiefer, and thanks for watching. The characters, organizations, and situations depicted in this scenario are fictional. Any relation to actual individuals, organizations, or events is purely coincidental.
Our next video explores the burgeoning relationship between treatment courts and treatment providers and vendors. It's called Should We Profit from a Nonprofit? And so on with the second video.
Opioid addiction is a national epidemic. Experts have estimated that up to 22 million Americans suffer from some form of drug or alcohol addiction. Progress in fighting this scourge has been valiant, although uneven. The efforts to cope have raised many ethical questions. How do courts ethically partner with private treatment centers that, by definition, are looking for a competitive edge? In this scenario, the Metropolitan Circuit Court, which incorporated the NACA Model Code of Conduct into its personnel rules a year ago, works with several treatment agencies. One of them is the De Wiley Treatment Centers, which is a national chain. So let's check in with Marla Stringer, a reporter for a local news blog, as she interviews Nick De Wiley, the CEO of De Wiley Treatment Centers, and his company's relationship with the Metropolitan Circuit Court.
Mr. De Wiley, I'd like to ask you about your network of drug and alcohol treatment centers. What makes your treatment centers so unique?
We are unique because we specialize in medication-assisted treatment. We have just partnered with a Chinese pharmaceutical firm that is producing a generic version of Narcan. It has proven to be effective at countering fentanyl abuse. We can now offer this medication at less than half of market price.
Well, aren't only specific firms authorized to produce Narcan?
I'm sure we will receive FDA approval eventually.
And what percentage of your patients are under court-ordered treatment?
I would say about 70% of our patients.
Do you lobby courts to order defendants to go to DeWiley treatment centers?
DeWiley Treatment Centers does not give money to courts or to judges. That would be unethical and illegal. We are civic-minded and donate funds to many community organizations. For instance, the Metro Circuit Court has a 501c3 nonprofit that supports drug courts. We think it does excellent work, and we have been generous to that organization.
But do you think DeWiley gets a competitive edge over other treatment centers because of your donations?
I have no idea, but it doesn't hurt.
I'm here interviewing Greg Legate, who heads up the local 501c3 nonprofit organization that helps the Metro Drug Court. Greg, looking at your public financial records, we see that DeWiley Treatment Centers contributed $100,000 to your organization. That is 10 times more than your next largest donor.
First of all, it isn't my 501c3. We work for the community. I don't personally keep track of exact donation amounts, but I do thank the Wiley Treatment Centers for being so generous. With that money, our 501c3 was able to purchase bus passes, food and housing vouchers, toys, and school supplies for children of drug-addicted parents. We even helped send Judge Alice Farrer, the drug court judge, to attend the annual conference of the National Association of Drug Court Professionals.
I'm here interviewing Presiding Judge Alice Farrer of the Metro Circuit Court. Your Honor, DeWiley Treatment Centers donates a lot of money to the local 501c3, so that money indirectly benefits the courts. Do you see any conflicts of interest in the court benefiting from DeWiley's largesse? I mean, Canon 1.2 of your own personnel rules says to avoid impropriety and the appearance of impropriety.
I'm afraid I don't have any idea what you're talking about. This court does not receive a dime of money from DeWiley Treatment Centers. We do, however, receive money in the form of grants from a community 501c3. And that organization is funded by donations from a variety of sources. We do excellent work with that money, including buying toys and school supplies for children of drug-addicted parents. This interview is over. Good day.
Over? I was like, oh, okay.
Before we join my two co-hosts, let's review a couple of the relevant canons from the NACA Model Code of Conduct.
Canon 1.2 calls on court professionals to avoid both impropriety and the appearance of impropriety, which includes avoiding improper business influences. It goes on to say that court professionals avoid relying exclusively on a single donor, vendor, or treatment provider. Canon 2.1 calls on court professionals to avoid relationships that would impair their impartial and independent judgment. It goes on to say that court professionals are vigilant to avoid conflicts of interest, and they ensure that outside interests never impair their ability to perform court duties. So let's join my co-host and our panelists as they discuss the ethical implications of this scenario. With me is my co-host, Carl Tonnes, Court Administrator for the 2nd Judicial Circuit Court in Sioux Falls, South Dakota. Our panelists include Danielle T. Rossetti, Clerk of the Superior Court in Guam, Sarah Brown Clark, elected Clerk of the Municipal Court in Youngstown, Ohio, and Elizabeth Rambo, Trial Court Administrator for the trial courts in Eugene, Oregon. I'm now going to turn it over to Carl, who will offer some overarching questions that viewers might keep in mind while watching this discussion.
Thank you, Peter. You know, normally we discuss these scenarios and we present these scenarios in a live presentation room, and we at some point take an electronic poll of the room. Of course, that's not possible in this format, but it may still be helpful or worthwhile for the panelists and participants and viewers later to keep a question in mind. as a way to frame this discussion and as a way to think of this scenario. Does a court need to investigate the sources of funding to a nonprofit if that court receives funding relayed to them from the nonprofit? In other words, do we need to always know the original source of any contributions to the court? I think that the couple answers that participants might consider is yes, the court needs to know the ultimate source of a nonprofit's funds before accepting contributions, or no, if a 501c3, or in other words, a nonprofit service organization is maintaining its government nonprofit status properly, then that should suffice for a court, and we shouldn't second guess the original source of the funds. And then I might mention just a very quick disclaimer, as a lot of these issues are sensitive and controversial in many jurisdictions. I just should mention, if I could make a local note, that specialty courts here in South Dakota are structured in such a way that some of these questions don't arise. So I just wanted to be cautious about that, as some of us work in jurisdictions where those sorts of issues may arise. South Dakota doesn't happen to be one of them. Thank you. And so if I could jump to the panelists then, Danielle, 501c3s are becoming a very popular way to assist problem-solving courts. Are there limits to how much assistance or what kinds of assistance courts should ethically accept? And how much assistance can a nonprofit or an outside entity or a grant funding agency ethically donate to the courts?
You know, I think, and like you or your courts, we don't have a situation that you described. But I think when you take a look at treatment courts and you take a look at the role that courts play, courts are leaders in therapeutic jurisprudence, and treatment courts have proven to be very successful for many, many years in rehabilitation and treating the offender. You know, but courts must always avoid impropriety or the appearance of impropriety. And so when you're talking about the limits and a 501c3, granted there are separate corporation setup, you just got to be careful about not having a hand in the corporation. Playing the role as the court and as the judge and overseeing the treatment court is important, and it's primary. And letting that 501c3 handle itself and trying to be as neutral and avoid any appearance of impropriety or getting involved in so much as the organization is set up. I think the courts can still play a key role in seeking grant funding. We do it in our courts. We seek grant funding to operate our treatment courts and to keep it running. And when there is a situation or an instance where a donor, as the canons say, you can't, it's got to be fair. You can't be to a single donor unless it's a sole source. And that without this donor or this vendor or this treatment program, the court would not operate, the treatment court would not operate. So there's a number of different factors that need to be considered. But quite frankly, initially, when you just take a look at it, if the court can be as neutral and impartial as possible in getting into understanding the 501c3, I think there's where you will address the limitations that the court can have into the organization and what role they play in the operation and the service that they provide to the treatment courts would be my take on that.
Sarah, as I may have mentioned in our discussions over the years since we've known each other, I'm always fascinated by the elective environment that you operate in, which is significantly different than the states that are generally appointed. So you may have a very different perspective on some of these financial issues, but do you have any thoughts on propriety of accepting certain contributions or how the courts can accept this sort of assistance?
Well, I'm pretty big on the public perception of the courts and the importance of our being fair and honest and impartial. So I would have to say to you that the first thing that I would say is there are no exclusive contracts. 501c3s are very competitive as they seek, because they are benefiting from the outsourcing of these services. And so you've got to be very careful about the public perception. And I would say And as this relates to the special docket courts that you're referring to, first of all, Carl, I have nothing to do with that selection process, but I would say that it would be very important to do RFPs and give everyone an opportunity to bid on the work. And in the event that grants are being written, because, you know, a not-for-profit agreeing to pay for a judge to go to a conference, I would hope that that was as a result of a grant and not someone saying, oh, we will just pay. We've got to be very careful about how people perceive us. And the best way to avoid any misunderstanding or any negative impressions is to do RFPs and be very careful about our relationships with 501c and other providers, because there are others who are not 501cs who are seeking to collaborate with the courts because it's a business and the collaboration is profitable. So we've got to be, let me use Elizabeth's transparency again. We've got to be very transparent in how we collaborate with these agencies. And these agencies can be extremely competitive. Now, if a court employee is serving on the mental health board and the mental health board wants a piece of the mental health court, that can be perceived as an impropriety. So, you know, we have to look at our involvement. Most of us have been involved with 501c3s. We've been on the boards. And if you're on the board and they're seeking a contract, you need to recuse yourself, or maybe that's not the board that you need to be on. And let's be clear, sometimes they find you because they think you can help them get the contract.
Would you say then that the courts ought to know where the money came from?
Well, 501c3s usually are funded by grants and state funds and et cetera. So they're a little different, but if you're contracting with a private agency, there are a lot of private agencies around here now. Yes, you need to know where that money comes from. What is their initial funding source?
Liz, if I could throw a curveball at you in some way, or a challenge, but what would you say to the objection that courts de facto make those choices and enter that debate when judges order defendants into certain types of treatment and courts enter into certain types of contracts? What would you say to the objection that we make that determination indirectly all the time?
Well, I would say that the way we counter that objection is by being actively involved in a cross-sectional advisory board. Those policy level decisions about the direction of treatment in your community should be discussed in depth at your local advisory board level. And so I think that the court does play an active role in that conversation. And I agree with Danielle that we shouldn't necessarily be advocating for one side or the other, but we should be aware of the implications of the different treatment methods and be able to fully participate in those advisory board meetings where the advisory board is trying to set forward direction and policy for your treatment court. And if you're, I think, being really good steward of having an advisory board that's fully participative, then you're going to get the kind of feedback you need to avoid the appearance of choosing one treatment provider over another because they offer a certain kind of treatment over another kind of treatment.
Carl, what are the points that impressed you the most?
You know, drug courts, especially courts, have been in operation, I think, originally in Florida for decades now, and we're still having these discussions, and I think that's appropriate. I think that it's important to keep some of these ethical standards and ideals and cautions in mind because we've got a high level of duty to the public. I again appreciate everyone's thoughts. It struck me as I was preparing for this session that we sign exclusive relationships with copy machine vendors all the time. We sign exclusive relationships with, you know, statewide multi-million-dollar contracts with case management software providers. And while they're not perpetual contracts, they extend for quite a while, and we're deeply invested in one particular approach or one particular vendor. So on some practical bureaucratic levels, I'm not sure why we should wring our hands about some of these issues. On the other hand, therapeutic courts and drug courts do some very creative, very non-traditional things. We've got an incredibly compelling, urgent social problem to try to address to the extent our role allows. Our role as the courts. And so this continues to be a really fascinating discussion, even decades after the first drug courts came into being.
My thanks to my co-host, Carl, and to the panelists, Danielle, Sarah, and Liz, for sharing their thoughts today on this ethics scenario. I'm Pete Kiefer, and thanks for watching. The characters, organizations, and situations depicted in this scenario are fictional. Any relation to actual individuals, organizations, or events is purely coincidental.
We hope you enjoyed the two scenarios, but more importantly, we hope you can see the potential of using videos like these to inspire thinking about ethics in the age of telework and Zoom meetings. Another real plus is being able to have court professionals share their insights regarding these ethical situations. These scenarios can be used in pre-recorded sessions that a single individual may want to watch at his or her convenience. They can also be a component of a virtual program such as a live webinar. And finally, they can be used as a video component of a live face-to-face learning environment. In a webinar format, a facilitator can use live polling and the chat option to enhance audience interaction. In a face-to-face environment, a facilitator can simply pause the video when he or she wants to engage the audience in a discussion. Just imagine an entire library of scenarios covering an array of topics. And the good news is that you're able to simply download the scenarios if your court or your state association wants to use them. I'll turn it over to Carl for some final thoughts.
Thank you, Peter. You know, I'll confess, my initial inclination is to prefer in-person sessions, the energy and the spontaneity. But in times like this, when we're operating under great pressures on a social level, on a political level, and on a practical level in the midst of this pandemic, this new delivery method might be an excellent way to keep ethics and our ideals and our principles at the forefront when so often otherwise practical pressures crowds that out. As you said a little earlier, this may not be everyone's initial preference, and I do miss that spontaneity, but on the other hand, this might be an excellent way to maintain those ideals and to explore our obligations to fulfill our public duties in the months and years to come.
As we said, we want to hear from you. Your suggestions will make these scenarios even more timely in the future. I also want to thank Judge Sabers, Carl, our panel of respondents, and our courageous actors. They were all very brave for agreeing to appear in these videos. I know I speak for Carl in saying, thanks so very much for watching.